Hello everyone, I'm Ben Gowland, I'm Director at UKIA Healthcare, and I'm going to give a quick run through on what's going on in relation to improvement in primary care, some of the challenges around it, and some thoughts on how to engage in primary care in wider improvement work that you might be involved in. Now, the really important starting point for any improvement work involving general practice are the problems that it's currently experiencing. And there's some stats there on the slides about those problems, but broadly they fall into two categories. One is that workload is going up beyond population growth, people just go and see their GP more and more, at the same time as capacity, in terms of the number of GPs available, is going down. And to the point where 93% of GPs say workload is negatively impacting on patient care. And the second area is that costs are going up. Indemnity fees, CQC fees, locum fees, cost of salaried doctors because there's not enough GPs, meaning that overall income for GP partners has fallen by over 20% in the last 10 years. So this sort of workload and finances are the key context for some of the challenges in general practice at present. And so the changes that general practice are currently focusing on are those that are in response to the crisis that they're in. Now broadly, those changes are happening in four areas. Now the areas listed there, so the sort of internal efficiency in the practice, essentially that's about matching capacity and demand in a number of different ways, whether it's booking and appointment systems, whether it's managing the admin of the work coming in. There's introduction of new roles because there just aren't enough GPs, physios, paramedics, physicians associates, different types of nurses such as mental health nurses, pharmacists, all of which can be cheaper as well as having more availability, but it's difficult for a lot of GPs in terms of making that transition from GPs running the work to other roles doing the work. Operating at scale is something that's happening increasingly, and I think the really important thing just to note about that is that in the past, practices worked together in federations primarily to try and get new work that happened sort of out of hospital to act almost as another income stream into practices. But now that's changing as a way of practices working together to create greater efficiencies. So our health partnership, which is a super practice in Birmingham, 32 practices working together, 135,000 population. What they're doing is having a single CQC registration, single accountant. They're doing a set of things to reduce costs across the practices. And I guess the fourth area is then general practice forming relationships with other organisations, which essentially is about accessing some of the economies of scale, the back office functions that they've already got, whether that's in the hospital or the community trust. It relies on this real building of trust between general practice and those organisations, and for a lot of the practices who are really considering this, it often is about they've just had enough and it's a way out from their current predicament. Now, of course, an important backdrop is the GP Forward View, published in April 2016, which promised a lot of investment into general practice. But I think the key thing to say about that is GPs aren't really experiencing the benefit of that money. They're finding it hard to access, and as a result, it's not having the impact that maybe you'd expect, the announcement of an extra 2.4 billion to have. One thing, though, I think it does provide is additional funding for improvement work in general practice, and it feels to me like there's not enough capacity to deliver the amount of work that is trying to be undertaken at present. So when we're making changes, there are some real challenges in general practice. First is obvious, they're under such pressure, so how do you persuade GPs to actually find time to do the change? The second is there is actually quite a restricted number, I would say, of real leaders within general practice. So you've got to find them and then persuade them to take on the improvement work that you want to take forward, and that can be difficult. And the third is, if it's between organisations, how do you actually build trust between general practice and those other organisations? And so when I think about what three things do I think might most help when you're trying to engage general practice in change, I'd say they're these. One, you've got to start with an understanding of the problems that general practice is facing. So, we've heard stuff in the media recently that GPs have all got to go to A&E to help out, which misses the point about the workload pressure that they're currently under, or they've all got to open 7 days a week, which misses the point about the fact there aren't enough GPs to cover in-hours services. I think the second is then thinking, following on from that, how can the things that you're trying to do impact on the problems that general practice is experiencing? So if you're trying to do a change piece in care homes, then think about, well, how could that link to visits in general practice, and how can we make that so it's less onerous on general practice time, not more onerous? And I think the third is, how do you engage with practices? And my experience is that there's no shortcut for this, that you have to do it at the level of the individual practice. You can't use CCGs or federations or LMC or anyone else as a proxy. The really successful ones, I was talking to the GP lead from the work in Yeovil, where the hospitals formed a really good relationship with the local practices, but they talk about 18 months of the chief executive and the lead GP going out to each individual practice and building that trust, explaining what they're trying to do, how they're trying to do it, and how this isn't an attempt to undo what happened in general practice, but to build on the strengths of it. So that's a really quick run through of everything that we've got. So some thoughts on the changes in general practice. If you want some more information, there's a few links there, and feel free to get in touch. We do a weekly podcast on innovation in general practice that you can access through the link in the slide. We've also got a book which has got 16 case studies of recent innovations in general practice, covering many of the areas that I've talked about. I've also added a couple of additional slides on operating at scale, new models of care, and the GP forward view money that might be of interest. Well, I hope that was useful, and I look forward to talking to you more about it on the webinar at 2 o'clock on the 25th.